It's time to find out the latest on Obamacare, and it's happening almost as we speak. It's just amazing to me. Our speaker is Rick Liuag, and he is a gentleman that I met 2 or 3 months ago, and believe me, he's a wealth of information. He walked in tonight and he said there is so much happening and so much has changed since October 1st. It's just hard to keep up with it all. At any rate, we're just very happy to have Rick come and speak to us. He has several online businesses in and outside of the insurance agent industry, and he's been doing this since 2004. So he specializes in helping individuals, families, business owners, and seniors navigate and survive the changes that are resulting in the Affordable Care Act. So let's welcome Rick. As he is talking, you can think about the questions that you want to ask. He's allowing plenty of time for your questions. If you jot them down, that might make it easier for you to speak, and then we will bring the microphone around and let you ask your questions.
Thank you, Carolyn. Amnesty and Obamacare. You got plenty to anger you tonight, don't you? Again, my name's Rick Liuag. I live in Corona, California, where I'm a licensed insurance agent, but I haven't always been an insurance agent. I was an executive with AT&T and MCI for several years until 1999.
Can you hear it in the back?
Can you guys hear me back there? A little bit better? Okay. I was an executive with MCI and AT&T for several years until I got a crazy idea to start my own company, and that was in Riverside. And in 2004, that kind of folded, so I had to start a new career. I was in middle age, and I had to reinvent myself, so I got into the insurance business. And I created what many would consider the very first virtual insurance agency that sold life and health insurance to business owners and individuals on the internet. Until 2010, when this new bill passed called the Affordable Health Care Act, when what I did is I completely changed my business away from a production-based agency to a consulting-based agency for one main reason. Not because I was angry about the bill, it's just because the insurance companies wanted to pay us half of what we were making before for just the same amount of work. So that didn't make any sense to me, so I became a consultant. And I started consulting insurance companies and insurance agencies about technology and how to use technology until, as fate would have it, right after the election in 2012, I was asked to speak to a group about this size of insurance agents about the internet and technology. And the gentleman that was speaking before me started talking about the Affordable Health Care Act. And I started listening and I started hearing, and so I went back and I called a CPA and a tax attorney that I knew, and I said, listen, this thing's not going anywhere. The election's already proven that it's not going to be repealed, and if we want to stay in our particular industries and consult with our clients, we're going to need to know what this bill says. So what we did around the holidays of last year, we took this affordable health care bill and we reverse engineered it. So we looked at it from each one of our levels of expertise, which would be taxes, law, and health insurance. And we would meet every week over scotch or wine, and we'd just compare notes, and we'd say, how did this get through? Who was reading this? And we got angrier and angrier and angrier. And what we did is we put together something called the Obamacare Boot Camp for consultants like us, for CPAs and attorneys and insurance agents, to teach them what this bill said and advise them on how they could advise their clients. So what we did is we wanted to break this bill down to see how this bill impacted our clients. And our clients were seniors on Medicare, business owners, and individuals and families who were responsible for their own health insurance. And I found a lot of crazy things in this bill, but I will tell you, each and every one of those groups are impacted differently. The bill impacts seniors differently than business owners and individuals and families. However, what you're going to hear tonight, you're probably not going to hear anywhere else. This bill impacts everybody differently, or those three groups differently, but it impacts all of us uniformly in two definite ways. The first way that this bill impacts everybody is anything that has to do with health care, health insurance, health care, anything that has to do with health care is going to cost more money. And in some cases, a lot more money. The first week in October, I got 2 letters, and they were from HealthNet. One was my new broker package to tell me how much the new rates were going to be, and the other one was a nice little holiday letter saying, "Dear Mr. Liuag, on December 31st, your health insurance plan that you like so much is going to be terminated." And you know, it's crazy because I go on TV, I see TV pundits about the bill, and I see TV journalists and I see politicians telling people that the reason why your health insurance was canceled is because you didn't have a very good plan. Well, I think it's kind of strange that journalists and politicians know more about health insurance than the health insurance companies and licensed and trained health insurance agents, because most of those plans that we had were approved by the Department of Insurance for each and every state. And most of us that know the industry, we knew what to pick. So the second way that everybody is impacted by this bill, and this is probably to me the worst part of the bill, is that everybody's access to health care is going to decrease, not increase. And it makes tons of sense when we start breaking this thing down by common sense. People ask me all the time, "Well, Rick, won't it be less expensive? If everybody has to have it, doesn't that decrease the risk?" Well, insurance is much different than any other product that you purchase. The more people that it covers, the more chance somebody's going to be really sick. So that's why group health insurance has traditionally been more expensive. The second piece of common sense about this is people ask me all the time, "Well, you know, now that everybody's got to be covered, won't we have better access to health insurance?" No. Here's why our health insurance rates are shooting through the roof. The 2 main reasons why our health insurance is skyrocketing is, number one, everybody's approved now. Now, George Litchfield sitting down here and we've been insurance agents for a long time. We can tell you that this system was broken. It needed to be fixed. There's no 2 ways about it. But the way they decided to fix it really didn't fix it. So here's what happens. Everybody is approved. What that means now is, if I can use the auto insurance as a good analogy, most of us get good driver discounts, right? If we don't have any tickets, we don't have any DUIs, we get a lower rate. If you have DUIs and if you have tickets, you have a higher rate, you have higher premiums. Well, now the insurance companies have to accept everybody, regardless of their medical condition or their health history. So what that means is that all of us are treated as if we have cancer or AIDS. So we're all getting the same rates as somebody that's very, very sick. The reason why access to health insurance is going to be so difficult is, I want you to imagine this. Imagine that Disney decides to give 2 million people a free annual pass to Disneyland who've never ever been to Disneyland before. They've never been to Disneyland, and that Disneyland pass is effective January 1st, 2014. Well, what do you think Disneyland is going to look like in January of 2014? Just because you have a pass doesn't necessarily mean you're going to get into the park. And just because you get into the park doesn't necessarily mean you're going to get on any rides. Well, it's already well documented that there is a chronic shortage of primary care physicians in the United States. It's already well documented. In fact, the Orange County Register talked about this in the very first week in October. So if you throw all these 2 million people into an overcrowded and overwhelmed primary care system, they're going to want to go see your doctor. The very first thing these people that get their new free health insurance are going to want to do is use it. Because the reason why they haven't had health insurance for the past several years is one of 2 reasons. Number one, they either couldn't afford it, or number 2, they had a pre-existing condition that precluded them from getting health insurance. So now they're going to be insured. What's the first thing they're going to do with their new insurance? They're going to want to use it. and they're going to go see your doctor, and they're going to want to go see my doctor. So primary care is going to be log jammed. It's going to be difficult. Now, specialty is not going to be as bad. Specialty is going to be okay. But your primary care physician is going to be log jammed. It's going to be so difficult to get there and see that doctor. So people ask me again, well, Rick, why are these premiums so high, so difficult? Well, I want you to imagine this. Here's another analogy for you. Let's just say that the government told the car industry, you can manufacture and you can sell any car that you want. You can call it anything you want, but in order to manufacture and sell a car in the United States, it has to have all of the same features and benefits, or all the same features and options as a fully loaded Mercedes-Benz S500, which is a $130,000 car. My plan is going from $359 a month to $997 a month. Basically the same plan, except for this. I have to now include maternity coverage in my new plan. So remember, going back to the car analogy, the government says to the car manufacturers, you can manufacture and sell a car in the United States. You can call it anything you want to. You can charge anything you want to for that car. However, it's got to have all of the same options as that fully loaded Mercedes-Benz over there. When people used to come to me and ask me for a health insurance quote, they literally had a choice between 120 and 150 different plans from several different insurance companies that we could customize and tailor to suit their needs. Now they have one plan. Because even though they have different, what are called metal categories, bronze, silver, gold, and platinum, they all have the same benefits. Every single plan, in order for it to be a qualified Obamacare plan, has to include all the things that you may or may not want. I'm 57 years old. We are not going to have any more kids. I can tell you that right now. We've got a 13-year-old daughter and a 10-year-old daughter. My insurance policy is going from $359 to $997. It has to include maternity, and I'm praying to God I never use that benefit. So that's why your insurance has gone crazy, because it includes all these essential benefits that you may or not want. And if you don't buy health insurance, get ready for this. You have a penalty. Now, there's a lot going on the news right now about this penalty being delayed. Don't get confused. The website means nothing. That's kind of a smokescreen. The websites don't work and all this. The real damage is the bill itself. That's the real damage. It's forcing people to buy something that, first of all, they probably can't afford, and secondly, it's forcing them to buy things that they really don't want or really don't need. And I can give you tons and tons of examples, but what I want to do is I want to go through each and every one of these groups, because I see everybody out there, and I know what you're thinking. Rick, tell me how this thing impacts me. But most importantly, can you please help me and tell me what I can do so this thing doesn't really kind of throw me under the bus? The questions that I get asked, you wouldn't believe all these questions that people ask me all the time. Well, Rick, what can I do to protect myself from this new bill? Well, let me first of all tell you how it impacts you. If you're a senior on Medicare, this bill impacts you more than anybody. Not financially, but it impacts your access to health care. And here's why. In the bill, one of the main funding vehicles for this new Obamacare is a decrease in reimbursement to Medicare providers. The way Medicare works, I don't want to bore you and confuse you, but the government pays your provider, Medicare, your doctor, X amount of money to treat you if you're on Medicare. Regardless if you have an HMO or a Medicare Advantage plan. Obamacare is now decreasing dramatically the amount that Medicare is going to pay doctors to treat you. Well, let me tell you what that's doing. For those of you out there that own businesses, think about this. The hospital in Lancaster is now starting to lay people off, nurses and technicians, and here's why. Because whoever's running that business, that hospital, realizes that now their revenue stream is going to be decreased. Think about your business. If you had a set group of people and a set group of customers that brought in X amount of dollars, and now that group was going to be diminished, your revenue stream is starting to decrease. So what's now going to start happening is doctors and medical providers are going to start not accepting Medicare or not accepting any new Medicare patients at a time when George and Terry would tell you 10,000 people a day, every day, turn 65 getting ready for Medicare. So here you got this perfect storm of Medicare. You've got all these people turning 65, and now you've got a decrease in reimbursement to doctors and hospitals, so fewer and fewer doctors are going to start to be accepting Medicare. And we've already seen it here in the Inland Empire. The second way that this impacts you is if you have Medicare Advantage. One of the products, one of the policies that Obamacare is targeting is Medicare Advantage. And because we're amongst friends here, I don't usually say this, one of the objectives of this bill, one of the objectives, in my opinion, is this, is that whoever drafted it and whoever passed it wants to make it so painful for us to have private insurance that we raise the white flag and say, surrender, 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 we want the public option. Anybody that has read this bill, that understands it, that has the perspective that I happen to have through the health insurance industry, anybody that has read this, you have to come to the conclusion that it was written to fail. It was never designed to succeed in any way, shape, or form. It couldn't, it can't. It's just too many people, too few doctors. So I think what the objective is to make it so painful for us to have our private insurance that we don't want private insurance anymore because we can't afford it. Now, I'm going to talk about, before I finish, what we can do. Before, I want to talk to you business owners. And I know you've had somebody come here and talk to you about how this impacts businesses, so I won't talk to you too much about that. However, if you are covered by your health insurance at work, you might think this doesn't impact you, and it really doesn't for the first year or so. But I'll tell you where it's going to really impact you, is if you ever have to use your insurance, because of the fact that primary care is going to be so booked up and so packed. If you're an individual and family, like I am, that is responsible for your own health insurance, this is what the bill says to you. Starting January 1st, you have to cover you and everybody in your family. If you do not cover you and your family with a qualified Obamacare plan. Now I've got enough time, so I'm going to tell you what a qualified Obamacare plan is. Remember I told you that most of my clients had between 120 and 150 plans that they used to be able to pick from and we could tailor it. Now you have one. Well, that one plan has to include all of these essential benefits: maternity, substance abuse, counseling and treatment, pediatric dental care, all these things that I don't want, but I got to pay for them. So if I don't buy my $997 Obamacare plan, I have to pay next year a 1% penalty or tax, 1% of what my total household income is, to not buy something. Next year it's going to be 2%, and the year after that it's 2.5%. So if your employer, get ready for this one, if your employer provides you health insurance, the moment your employer provides you health insurance, you are immediately disqualified from going to the exchange and getting a discounted plan. Let me reverse back on that, okay? If you are an individual and family, you have to purchase health insurance. If your employer is not providing it, you can go to what's called the health insurance exchange and get a subsidy. And that subsidy is based on your income. Now this isn't for you seniors, this is just individuals and families under age 65. Under $35,000 a year, you're going to be put on Medi-Cal, whether you want to or not. Medi-Cal. Now this is what I just learned, and this completely freaked me out. Terry and I were talking about it a little while ago. I just learned this in the last 4 weeks. If you earn between $35,000 and $95,000 a year, total household income, $35,000 to $95,000, you may qualify for a subsidy for your health insurance. But you have to purchase it through the state exchange. But get ready for this. If you're a family of 4 and you make roughly just under $70,000, anything between $30,000, $35,000 and $65,000 or $70,000, and you purchase your health insurance through the California exchange, your children will be enrolled on Medi-Cal, whether you want them to be or not. Now, some of you don't know what Medi-Cal is, but Medi-Cal is the Medicaid for California. Here's the problem with all these new people going on Medi-Cal. More and more doctors aren't going to be accepting Medi-Cal anymore because of the deep reimbursement. So here's what you're going to have. You're going to have all these people running around with new health insurance, but they won't have a doctor to go see. For those of us old enough to remember, I told Terry, it's like having a free annual pass to get into Pacific Ocean Park. Remember that place, Marineland, out in the Pacific? It's closed. It's gone. So you're going to be saying, I got my insurance, but you can't go see anybody. So think about that. If you make between $35,000 and $70,000, you can get a subsidy, but your children are most likely going to be forced onto Medi-Cal, and fewer doctors are accepting Medi-Cal. I went to a meeting for Anthem just recently. Anthem is the largest provider of health insurance in the state of California. Here's what they told me. And they kind of said it like this. 40% of the doctors that were on our network last year are not going to be on the new network. So if you have an Obamacare plan that you purchased through the exchange, the chances are you're going to lose your doctor and hospital that you've been used to using, okay? I want to make something perfectly clear. Whether you purchase your insurance from the exchange or whether you purchase it directly from a health insurance company, it's all Obamacare. It's still the same because you have to purchase a qualified plan or pay the tax. So it's all, most people think this, well, Obamacare is when I purchase it through the exchange. No, because HealthNet and Blue Shield and Anthem and Kaiser, they're selling Obamacare plans to folks that make over $95,000 a year. That's what I have to buy, is still an Obamacare plan. So what can we do? Because I talk all the time to Rotaries. I'm traveling all around the country talking to Rotary and Kiwanis, and people are telling me, when they hear this, they say, oh God, Rick, you're making us, we hear all the bad news. What's the good news? And I can't think of any. I can't think of any. And when some people say that, they'll say, well, Rick, isn't it true that now all these millions of people are going to have health insurance that couldn't get it before? Well, yeah, but it's like Pacific Ocean Park. They're going to have insurance, but they're going to have a hard time getting in to see their doctors. It's going to be crowded. It's going to be packed. You got millions of people now covered, and you've got an awful lot of people footing the bill for this. A lot of people are going to be paying a lot more than they're paying now. I'm not the only one in California whose rates have gone up 276%. 359 to 997. That is a brutal rate increase. It's a brutal rate increase. But I got to do it or else pay that penalty. Now, what can we do to protect ourselves? That's the question that I get probably more than anything. Most people already know how bad it is. They've got their ideas and they know how bad it is. One more thing that I promised Carolyn that I would talk about is the death panels. Now, there are no death panels, okay? What it really is and what they're talking about is something called the Independent Patient Advisory Board. Now what that is it's a 15-member panel of non-elected officials, and I'll tell you why it was done this way, is because Medicare has always been called the third rail, right? It's always been called the third rail. Nobody wants to step on Medicare. Nobody wants to do anything about it. So what the proponents of this new law did is they said, here's what we're going to do. We're going to pick 15 people who are non-elected officials, so they're almost immune from elections, And we are going to put them in charge of finding more cuts in Medicare. Now, I got chewed out at one meeting by somebody that said, well, yeah, but they can also find increases in benefits. I said, no, they can't. Their entire job is to find further decreases in Medicare. Now, they're not going to tell you that your 85-year-old mother can't have a knee replacement. They are not death panels, but here's what they are chartered to do. Here's what they're going to do. They're going to kind of tier benefits. So here's what they're going to say. A knee replacement from 65 to 70, this is what the reimbursement rate's going to be. A knee replacement from 70 to 75, this is what the reimbursement's going to be. A knee replacement from 80 to 85, this is what the reimbursement's going to be. So here's what's going to happen. My mother, 83, she's going to go get a hip replacement or a knee replacement. Nobody can deny this. No surgeries, knee replacements, hip replacements, and cataract surgery has improved the standard of living for seniors better than any other surgeries in the last 30 years. Knee replacements, hip replacements, and cataract surgery. So here's what this Independent Patient Advisory Board is supposed to do. They're supposed to say, okay, how much are we going to reduce reimbursements for people 85 for this service? So here's what's going to happen. My 83-year-old mother or 84-year-old mother, she may want a hip replacement or a knee replacement. The doctor or Medicare is not going to say, we're not going to pay for that. Here's what's going to happen. The doctor's going to tell my mother, I'm sorry, Mrs. Favreau, but the Medicare reimbursement for this knee replacement at your age is only $4,000, and it cost me $6,000, and that's what it's going to cost, $6,000 to $8,000. Well, get ready for this, because I couldn't believe it. We had to double check it three and four times. If I said to the doctor, I don't care what it costs. I don't care that Medicare is going to reimburse you $4,000 and this surgery costs $6,000 or $8,000. I'll make up the difference. It's against the law for that doctor to take that difference. Most people don't know that. That doctor could take a beating. His Medicare reimbursement rate could be lowered. So here's what's going to happen. People with means are going to start going to cash doctors. More and more doctors are going to start taking cash. It's already started here in Redlands. There are people that George and I know that are already forming what are called concierge medical practices. You're probably hearing about them. Pay $500 a month and you have access to this medical group right here. The Affordable Health Care Act was sold to us that it was going to make health care equal for everybody. We wanted to level the playing field. It's doing the exact opposite, because here's what's going to happen. The folks that are middle class and below are going to be hoarding after the few doctors and hospitals that accept health insurance. Those with means, the best doctors in the country are going to start saying this: I'm not accepting insurance anymore. I have to jump through too many hoops. I have to fill out too many forms. I have to do too many reports. I'm no longer accepting insurance. If you want me to do your bypass, if you want me to do your back surgery, if you want me to do your cataract surgery, you're going to pay me $25,000 in cash. So here's what's going to happen. It's sad but true. It's putting a bigger schism between the haves and have-nots. So those with means are going to be going to these cash doctors. You know what else people are going to start doing? They're going to start traveling to Taiwan, or they're going to go to India, and they're going to go to other countries to have their hip replacement and their knee replacements done. Johns Hopkins already has a center down right below the border in Mexico, right past the border in Texas. You would think you were in Johns Hopkins. All of the doctors, all of the nurses, all the technicians were trained at Johns Hopkins. It's just right across the border. So people are going to now start doing what's called medical traveling, things like that. What can you do to protect yourself if you're a senior? It impacts you more than anything. Here's what I would do. If you were my client, here's what I would tell you to do today. Today. Don't wait another minute. The first thing you do is you contact your primary care physician and you ask him or her, are you still going to be accepting Medicare next year? The second thing you do this year, have your mom do this or your aunt or uncle. You contact your primary care physician and say, do you foresee me needing any specialist in 2014? Any. And then, as quickly as you can, you set up an appointment this year with that specialist. Just a consulting appointment. Because here's why. What you don't want is you don't want your mother, or you don't want to have your doctor tell you next year, well, you need this urologist. You need this cardiologist. So you call up and set up an appointment and they say, oh, I'm sorry, Mrs. So-and-so, we're not accepting any more new Medicare patients. And you can say, oh no, wait a minute. I was on Dr. So-and-so's books in 2013. Oh, that's right, that's okay, we see you right here. So it's very inexpensive insurance for you to get on some specialist book now. The third thing that I would do and advise you to do if you're a senior on Medicare, and this is also holds true for individuals and families that have to pay for their own health insurance. The name of the game next year is this. Remember this. If you forget everything I say and remember just this, starting 2014, the cost of medical care will be as critical as access to medical care. Access to your doctor is going to be as crucial as the cost. The sad thing about health insurance, and George Litchfield will attest to this, is the sad thing about health insurance is you don't know what you don't have until it's too late. You don't know that what you have isn't adequate until you need it. You don't know that. So what I would recommend that you do for next year is you would improve your access to health care. And the way you do that is this. You supplement like crazy. And what I mean by supplement, and if you are responsible for your own health insurance, even if your employer pays for it, you should supplement. And here's the supplements that you need. We've been selling these for years, but we never really advised our clients to get them because they really didn't need them. But now the game has changed. Everything's changed. So here's what you need to do. The very first supplement that you're going to want to consider, whether you're a senior or you're a mother that has children, is a telemedicine plan. They're cheap. They are so inexpensive. They're about $30 a month for the whole family. And here's how they work. They're very simple and easy to use. Every single health insurance plan has a nurse hotline, right? Nurse hotline where you call the nurse. They're worthless. They're worthless. Here's why. The nurse can't diagnose or prescribe medication. Well, here's how I've used my telemedicine plan. I've got a little 10-year-old that has a propensity to get ear infections and sore throats, and she's out of school for a couple days, and it's just a quick antibiotic. But I'm married to a doctor's daughter, so we are in the doctor's office all the time. I've got a 13 and a 10-year-old, and I swear we've probably called the doctor 50 or 60 times in the last 13 years. 50 or 60 times. That doctor has never, and it's for the same thing over and over, that doctor has never prescribed medication on the phone. You know why? Because he wants me to come in and pay the copay so he gets paid by the insurance company. But those days are going to be over where I could just go in and out. So here's how I've used my telemedicine plan. I pick up the phone, I call the 800 number, the doctor calls me back within an hour. Starting next year, the only way you're going to see a doctor within an hour is when the ambulance takes you to the emergency room. So that doctor called me back. I'm going to give you a real life example. 9 o'clock, I called the doctor. 9:15, he called me. Doc, this is Rick Liuag, my little daughter Ellie. You can see her medical record on your computer. She's got sore throat, postnasal drip, earache, no body ache, no fever. Oh, Mr. Liuag, I can see she's allergic to Cipro, blah, 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 blah. Well, I'll tell you what, I'm going to prescribe her a Z-Pak. Do you know what that is? Oh, yeah, I've had that before. Where do you want me to call it in? I want you to call it into Stater Brothers right down the hill. Okay, what's the phone number? I called at 9:30. The pharmacist said, oh, yeah, Mr. Liuag, Dr. Rodriguez called in the Z-Pak. You could pick it up at 9:45. At 9:45, I drove to Stater Brothers. I paid $19 for the Z-Pak. I never had to take Ellie out of bed. I never had to go sit in the doctor's office for an hour or 45 minutes. I didn't pay the $45 copay. Do you know how critical that's going to be starting next year? Anybody been to Disneyland and used a fast pass? The telemedicine plans are going to be your fast pass to primary care next year. If you're a senior on Medicare, you can use a telemedicine plan to get most of your prescriptions refilled on the phone. The second plan that I'm going to recommend to everybody, they're little inexpensive plans, talk to your insurance guy, is an accident and injury plan. If you've got children that are active in sports, every one of these plans now, you're hearing it, they all have high deductibles, $5,000, $12,700. That plan that's going to cost me $997, it still has a $4,000 deductible and a $13,000 maximum out of pocket. So what I've done is for a few dollars, about $50 or $60 a month, I now have an accident plan that covers everybody in the Liuag house for up to $25,000 for any medical expense incurred due to an accident or an injury. So guess what that covers? My deductible and my maximum out of pocket. If you're under 50 years old and you have children, the chances are 4 times greater that you're going to be put in the emergency room or incur a medical expense because of an accident, not an illness. So these little inexpensive accident plans that you can get. The third plan that you need to get, and especially seniors, if you can qualify for this, this is going to be huge. They're called critical illness plans. These are also inexpensive plans that will pay you a lump sum of cash if you're diagnosed with a critical illness or a terminal illness, or if you have a chronic event like a heart attack or a stroke. It'll pay you a lump sum in cash. Now, why I'm saying supplement is because these supplements pay you the cash directly to you. Then you get to pay the doctors of your choice, whoever you want to use. So supplementation is going to be huge starting 2014. Okay? So there's a lot going on with this bill. There's a lot of crazy things about this bill. It's changing all the time. People ask me, is it going to be repealed? I don't think so. I think the genie that's out of the bottle is this. The genie that's out of the bottle that will never get put back into the bottle is guaranteed issue. I think that's here to stay. I don't think we're ever going to see a day when there's underwritten policies anymore where if you're healthy, you get a certain rate, and if you're sick, you get a certain rate. I think guaranteed issue is here to stay. This bill is going to move and it's going to change. There's something I'm going to say that I don't say very often. I do say it in private. Is I want you to pay very, very close attention to some things that are going on. Is I think what the idea of the bill is to go to single payer. That's pretty evident, okay? And I think that's the whole goal of this bill. And what I want you to start noticing is, because I've noticed it since I've been studying this bill, is I want you to see these big gigantic facilities that Kaiser is building. If health insurance is going backwards, and if doctors are going out of business or they're retiring, why is Kaiser building these gigantic facilities? And guys, if you drive down the 91 in San Marcos, these aren't small little facilities. These dwarf any hospitals around here. I think, and this just is my opinion, I think what the whole goal is to have a single payer universal care with what are called accountable care organizations. For those of you that have been in the military, you'll know what this is. It's a regional hospital. In the military, we had local hospitals or clinics, and then if you got really sick, you'd go to a regional hospital. So I said, I think the whole goal of this is to have these Kaiser facilities, because think about this. The model plan, remember there's only one plan in California. You've got the bronze, the silver, the gold, the platinum, but it's all one plan. They all have the same benefits. The only difference is how much does the insurance company pay? 60%? Or you pay 60 or 90%? So if the model plan that the state of California used as the model plan that all the other insurance companies had to model after was the Kaiser plan. It was the Kaiser plan. Now, I have no bones about Kaiser. Kaiser's a great facility. However, I'm more apt to pick PPOs, and this is why. Kaiser would be fabulous if we lived in Kansas. But I want you to think about something. We live within a 2-hour radius of some of the greatest medical facilities on the planet Earth. There are medical facilities in our region here that heads of state fly into to use. If my child gets sick, I want them to either go to Chalk or Loma Linda. I want to pick the very best medical care I can for my child. So that's why I usually choose PPOs. Again, I've got a lot of clients that love Kaiser, but if I live right up the road from Cedars-Sinai, I'm going to pick that almost every single time. So that's why our choices are being taken away. I've got a lot more. We've just kind of covered the tip of the iceberg. There's so much more, but I do want to say this, okay? There's two websites that I want to invite you to go to. The first website is called myfreeobamacarereport.com. And what we did, the three of us, the attorney, the CPA, and me, we put together 3 reports that just kind of outline some of these things, how it impacts you, and some of the strategies that I told you that you could use to get around it. You can go there and download these free reports. My free Obamacare report, there's 3 of them. If you're a senior on Medicare, there's one for you. There's business owners and individuals and families. And the other thing that I want to invite you all to have is we just finished, the very first boot camp series that we did was called the Obamacare Boot Camp for Consultants. And it was designed to teach CPAs and attorneys and insurance agents like George and I how this bill works and how to advise our clients. We did one for doctors and we did one for business owners. We just finished the one, Obamacare Boot Camp for Individuals and Families. Now, it's sold online for $20 or $25, but I want every one of you to get that for free. So here's what I want you to do. If you want that, it's a 3-video series. The first video tells you all of the minefields and pitfalls and all the problems with Obamacare, all of them. The second video teaches you how to order your health insurance if you're going to buy an Obamacare plan. And the third video teaches you what you can do if you can't afford Obamacare or if you just want to bypass it altogether, what you can do. And it's basically the same strategy that I'm using for myself. So here's what I want you to do so you don't have to pay for that. I want you to send me an email. This is my email address, Rick, R-I-C-K, at RICKLIUAG.com. Rick at rickliuag.com. Just send me an email telling me that you were here, and I'll send you a password to download that and go on there for free, no cost. Okay? Rick at rickliuag.com. I want you to have that. Again, there's so much about this bill, so many moving parts. I'm happy to open it up for questions now, Carolyn, if you guys want to do that. Questions, anybody? Comments, questions, anything?
Catherine.
Yeah, is there such a thing as reinsurance for businesses?
Yeah, there is reinsurance. And in fact, I was just talking to somebody today about a brand new product that's coming out for businesses that are going to self-insure. Is that what you're talking about? Business owners that want to self-insure? Get with me offline and I'll get you somebody to talk to that's specializing in that. It's really, it's very, very, contact me. Now, I want y'all to know something, is that I know a lot about this bill, but I don't know everything about it, but I do know more than the knuckleheads that signed it into law, that's for sure.
I've heard that Obamacare is also a data mining enterprise. Can you comment on that?
I didn't even talk about that, and that's something that should probably concern you, but to be honest with you, it doesn't concern me as much as the fact that they want to control my health care. And I have a lot of people contacting me all the time saying, I really don't like putting in my personal information in here, blah, 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 blah. They already know it. They already know everything about us, okay? They're already eavesdropping on us like crazy. So there's a lot of, here's what I don't like. I don't like the questions that the doctors now have to ask us when we go into the office. Do you have a gun? Do you, there's some crazy questions those doctors have to start asking us.
What happens if you don't answer the questions?
Nothing. I mean, think about this. There's not a lot of teeth in this thing. Here's a couple things that I want you to think about. Is that penalty that's going to be imposed on you, that our buddy John Roberts said was a tax, okay? I can hear the moans there. I wondered, why'd you throw us under the bus like that? However, that penalty, I want you to think about this, is in the bill, right now, the way it's written now, there's no teeth in it, so they can't levy your wage, they can't garnish your wages, they can't attach any of your assets, they can't levy anything. The only way that they can recoup that right now, if you don't pay that penalty voluntarily, the only way they can get it from you, the way it's written now, is to keep your tax return. So what people are going to do is they're going to up their deductions and not get a tax return. Okay? But here's what I want to warn you of. The agency that's responsible of enforcing this bill is not the Department of Health and Human Services on the penalty side, it's the Internal Revenue Service. So keep that in mind if you decide not to pay the penalty. They're going to start tacking on the same things here's why. They've called it a tax. So if you don't pay your tax, bingo, there you go. So, yes, sir.
Sam?
You said concierge. Did you really mean $500 a month or $1,500 a year?
Well, I got to tell you, it varies. It varies across the board. I've had people tell me that their doctor said for $600 a year. Now you have, and for those of you that don't know what he's talking about, concierge medicine, the best way for me to describe concierge medicine is Redlands Country Club. Okay? That's exactly what this is going to be like, is that a group of doctors are going to get together and they are going to allow you to have preferred appointments, telemed services, and they're going to call it a concierge medical practice, but you're going to pay a membership fee. For those of you that have ever been to a country club, you pay an initiation, a membership fee. You still have to pay for your golf balls. You still have to pay for your golf cart. You still have to pay for your clothes. You still have to pay for your food. Just you get your membership. So that's what concierge medicine is.
Don?
Hi, I was wondering, why aren't the insurance companies speaking out? I mean, you would think there's got to be...
Because they're getting rich. No, really.
How are they getting rich when they're
'cause here's why,
losing
okay?
their clientele?
Now, they are starting to panic a little bit. But think about this. This bill would have never passed without the approval of the health insurance companies. And here's why that individual mandate is so critical. Is the insurance company executive said to the government, okay, we'll accept all the sick people. Because we know they're going to file tons of claims. But you better ensure that everybody else buys health insurance at the new rates that we're going to charge, because the only way that we're going to afford to stay in business is we're going to be able to charge Rick Liuag from $359 to $997, and that's how we're going to make up for this. So the health insurance companies, if everybody purchases health insurance, will have a windfall. They'll make a lot of money, okay? They will make a lot of money if everybody purchases health insurance. But here's what's starting to happen. Is people are going on the Covered California site, they're going on the healthcare.gov site when they can get on there, and this is something that hasn't been told to you. The first week, 1 million people went on Covered California. 1 million people went up there and saw. 29,000 or something actually signed up. That's a pretty low conversion rate, but most of those 29,000 were people signing up for Medi-Cal. There were most of the people signing up for their free health insurance. Here's what's happening, because my clients are doing it. They're going on Covered California and they're typing in, and the biggest misconception about this bill has always been, oh, we're going to get free or greatly reduced health insurance because it's called the Patient Protection and Affordable Health Care Act. So they go on there, Mr. and Mrs. Jones did this on October 1st. They type in, okay, honey, how much do you make? I make $60,000. Okay, I make $40,000. That's $100,000. Okay, let's go get our free Obamacare. And it says $1,400. $1,400. And they're shocked. Well, I guess the website's messed up. We got to come back when it gets fixed. No, the website's not messed up. The people that are damaged the most by this bill, besides seniors, is anybody with a total household income of over $95,000 a year who's relatively healthy. You're getting killed. We're getting nailed on this bill.
Hi. I know one of the ways that companies are getting around the bill, or trying to, is by outsourcing their labor to temp agencies. Do you see that as like a long-term?
That's a
option?
huge business. Yeah, that's a huge. But another strategy. Okay, people cutting back hours to 30 hours. They're leasing employees. However, some of the calculations for businesses they're now calling them full-time equivalent. That one little quote there, equivalent's going to. That's a very ambiguous term. Okay, so another thing that people are doing. My sister-in-law and brother-in-law thought about doing this. They have a very big business, about 120 employees. They were thinking about cutting their 2 businesses in half to get, or even in 3 businesses to get it below 50 employees. Can't do that because you can't have any common ownership. So it's very tough to get around this bill. I'll tell you how most people that make over $100,000 a year are going to get around this bill. They're going to pay the penalty and they're going to buy a la carte coverages, and go to that website, and take the boot camp. I'm going to teach you how to do that. If you make over $100,000 a year, it's going to be almost impossible to afford this health insurance, especially down here in Riverside County. Let me tell you how it's $100 more for policies down here than in Northern California for the exact same people. So people are not going to want to pay $1,500, $2,000, $2,200 a month for health insurance with no subsidy. So they're going to start picking up, just like you do when you go to Morton's or when you go to Ruth's Chris. You're going to order your health care coverage a la carte. I'm going to take a critical illness plan, an accident plan, and then that's how you're going to cover yourself and pay the penalty, and you're going to probably have better coverage.
Next.
We have been having some very unsettling news, and thank goodness you're here to give it to us.
Oh,
But I think it's time for a little bit of humor.
thank you.
We'll be the judge of that.
We all know our favorite Democrat. Who is it? Nancy Pelosi. And she is the one who wrote, as a matter of fact, she said it, we have to pass it before we know what's in it. You know, it occurred to me that isn't that the definition of a stool sample? Thank you.
Good job. Jackie.
That's
So, Craig,
a doofus for you.
I
Hello.
think what we need to do here is finish our meeting, and then we can either have Rick talk more from the podium, or he can talk to you individually. But it is 9 o'clock, so let's do our raffle, and then those of you who need to go home or want to go home, you can do so. But Rick is kind enough to stay and talk with us, so.